Hi, I'm Gary White with Channel 6 Central Kentucky Television, and I have with me here Margaret Neal, who is the Executive Director for the Nelson County Community Clinic, having a celebration here today, retirement of the inaugural medical director for the Nelson County Community Clinic, and bringing on a new one as well, right?
Correct. Dr. Abramovich is retiring as of December, so now we have Dr. Davidson coming on. So, very excited.
Fantastic. And this is, again, at the Nelson County Community Clinic, and we're going to get a chance to talk to both doctors and get to know them, and you can come and visit with them as well. But tell us just a brief little thing. Who does Nelson County Community Clinic serve?
Okay, Nelson County Community Clinic serves Nelson County residents who are low income, uninsured or underinsured, working or medically disabled by the Social Security Administration, and we help with medical, dental, vision, prescription assistance, and Medicare benefits counseling.
And you can give a call and get some more information. How can they contact the community clinic?
At 502-349-5990.
That's great. And again, if you'd like to make a donation as well, Margaret would be happy to talk to you that way too, right?
We would love that if you would like to do that.
All right. Thank you very much. Again, we're talking with Margaret Neal, who's the Executive Director for the Nelson County Community Clinic.
Thank you.
I'm here with Dr. Mark Abramovich, who is retiring. Congratulations.
Thank you.
And Dr. Abramovich was one of the founders and creators of the community clinic here in Nelson County, correct?
That's correct. We started in about 2006.
Okay.
Yep.
So tell me, how did that come about? What made you decide to start the Nelson County Community Clinic?
The major problem that was going on and had been going on for quite a while is indigent patients. Patients that either had no insurance, low insurance, they may not have required so much medical attention, but when they got sick, it was a very big, money-wise problem. So what we did in 2006, several doctors in the medical staff at the Flagey Hospital, we all got together and we decided to start and run a clinic once a week. And one of us took turns, and it just evolved into a very steady practice type thing. No one paid anything, and we took good care of people. That's what it was about.
And you've been the medical director for the clinic until this past October, right?
Yes. Yes. I resigned from it in October, and but I did helm the facility for quite a while. Yeah.
So has it always been in the same place it is now?
If I recall, yes, it has been in this office here. Yes.
Okay.
Yes.
And what would you say has been the benefit for the community clinic for the community here?
Well, the biggest benefit for the county has been essentially free medical services for people that didn't have any insurance or had low insurance. Right. And we basically kept these people out of the emergency room, which is extremely expensive.
Right.
So that was the good part.
So it's actually providing services to those who are either uninsured or underinsured,
right.
But it's actually potentially saving money for the rest of the community as well.
Exactly. It takes a lot of load off of the primary care docs because most people, you have to pay as you go. A lot of them don't have insurance, and so it was very difficult for them to get in because they would run up big tabs. So we took care of that problem.
And for you personally, what was the highlight for you as being medical director and being part of the Nelson County Community Clinic here?
The two things about that was that prior to 2006, we had no clinic like this. So there were lots of people that put off their medical care because they didn't have the money.
Right.
So, and then they would come into the emergency room, which is extremely expensive, sometimes go to the hospital because they let something go and could never pay the tab. So that was a problem. Even though Flagey Hospital had a reduction in fees based on income, such and such, but it was still a pretty big burden. So what we did was anybody that came into the free clinic and was qualified to, because of financial issues, we would see them, take care of them, give them free medicine, free medical care, and a follow-up, and that's just how it just exploded.
And as a medical director, what did that entail for you for the 14 years?
I spent a lot of time in this clinic. actually, this was my former office.
Okay.
Yeah, so I knew how all that worked. And I wanted to make sure that there was definitely a medical doctor on staff working the clinic. And at the time, I recruited all the family practice guys that were working at Flagey Hospital. We were all in the same group there, and we kept that going for quite a while. And that was a good thing. So it just evolved, and here we are.
And it's a great legacy that you have here with the Nelson County Community Clinic. You retired from the clinic here in October. Now you're retiring from your practice, right?
Yes, yes.
So what's laying ahead?
Relaxation
Yeah.
and reading a lot of books.
Okay. Do you have a book that's first on your list that you've been putting off that you really want to touch? What topic do you like?
I like mysteries.
Okay.
And I've got 4 or 5 books at home right now from the library, and I'm working through them all, and it's all good.
That's great. Well, thank you very much, and thank you for starting the Nelson County Community Clinic and all that you've done here. Again, it's the retirement for Dr. Mark Abranovich, and thank you very much. I'm talking now with Dr. David Sindler, who is the new medical director here for the Nelson County Community Clinic. Started in October or so?
Correct.
Right? Okay. Tell us a little about yourself.
Well, I'm actually a Florida native. I came up to Kentucky because my wife is from Kentucky. We met while I was in medical school, and I interviewed around different places in central Kentucky and landed in Bardstown.
And now you're a UK fan, it looks like.
Exactly. My wife is a UK alumni, and so I am therefore a UK fan.
Calling in. Okay, very good. So tell us, what's the job of the medical director here for the Nelson County Community Clinic?
Well, this clinic is open, currently we're open just once a month, and we see patients who are working low-income persons, provide medical care, dental care, mental health care, completely free of cost.
Right.
So I see patients when the clinic is open, and then also any help I can offer in terms of applying for grants and keeping the place open.
And it is, as we said, available for those who are either unemployed, underemployed, underinsured, or not insured at all.
Exactly.
So there's always fundraising efforts, right?
Yes.
Is that the biggest challenge that you see here for the clinic?
I'm relatively new, so I'm still kind of getting to know what the different challenges are for the clinic. But for sure, I mean,
It's always an issue.
Yeah, it's definitely always an issue.
Yes,
yeah.
Absolutely. Well, thank you very much for taking on this job for us here at the Nelson County Community Clinic and overseeing the operations as the medical director. Right?
You're welcome. Right. Yeah, I'm happy to do it.
Great. And again, it's Dr. David Sindler, who will be the new medical director for the Nelson County Community Clinic. Thank you very much.
You're welcome.
This is Gary White for Channel 6 Central Kentucky Television.